Welcome, everyone, to today's episode of Dare to Age Well Now. I'm very excited to be joined by Dr. Tanisha Ward from Austin, Texas. Dr. Tanisha, tell us a little bit about yourself.
Yes, my name is Dr. Tanisha Ward. I own Infinity Wellness Center. We're a functional medicine practice in Austin, Texas for 18 years. And I actually just recently moved outside of Dallas on 11 acres. So I'm actually doing a lot of telehealth, but also seeing some patients in Austin, seeing some patients outside of Dallas. And our focus is really finding and fixing the core root cause of what most Western medicine doctors would just call symptoms that you have to live with. So chronic fatigue, chronic pain, brain fog, anxiety, GI issues. We believe there's always a cause for those, and finding and fixing the root cause is our focus versus covering up the symptoms or being told you have to live with them.
Yeah, my favorite thing is to go to the doctor and then go to another doctor and get some tests. I actually haven't done this, but I do have friends that have been this journey. And then you get to all of that, and 2 years later, they say, we can't really find anything wrong with you. And you're like, are you kidding? I just spent how many $1,000s and how many hours, and then the angst of not knowing, and I'm still in pain, and I'm sorry, but your pill didn't work.
Yeah.
It's super common.
Or worse, your lab tests are normal, so you must be fine, knowing they
Uh,
didn't dig very deep or they didn't run in very many intensive lab work or they didn't dig very far, I should say. They didn't really go beyond just some basic lab work. Are you gonna make it this year kind of thing, your basic labs, and so they're not really sometimes digging for core root causes. And I feel like a lot is changing right now in our healthcare system. Obviously, a new Surgeon General that is a functional medicine doctor is, I think, really going to change the way that the body's looked at. But for the last 19 years I've been in practice, that has not been the case. It has been, how can we numb it? How can we cover it? How can we make you feel better so you can muscle through, but not really try to find and fix and really pull out the root of the issue. And that's what we do.
I love that. I actually had just this week had a conversation with somebody, and they were beginning to see the symptoms of menopause, and they went in for their annual exam and talked to their OB-GYN and were like, hey, I'm starting to see this, this, and this. And they were like, literally the doctor said, oh, let's just watch it. I think you'll be okay for another year. Let's look at it. And you're like, you expect me to
Yes.
like so many things were like catch it before it gets really bad. With your car, if it's starting to make a noise,
Yes.
you don't wait until it's
Yes.
really bad. And I was like, are you kidding? That was their strategy, was you'll be fine for a year. And then the next year they're like, so how's that going? And it's like, it's worse. And it was mind blowing to me that that was the answer. I'm not trying to blame doctors. This is not hating on doctors.
I
I
know.
do think the system is designed, and I say that a lot on this podcast, it is the system. But you have some very interesting kind of specialties within that, because a lot of the people we have on the podcast, whether they're chiropractors, functional medicine, they say we go to the root cause. But you specifically have, it sounds like a personal story that kind of lends itself to what your focus is, right? Tell us
Yes.
about
Yes. So
that.
a couple thoughts before we dive into
Yeah,
that.
perfect.
About menopause, I think this is worth noting is that in many other countries, there is not a translation for the word menopause in other languages because a lot of people don't have a slew of terrible symptoms that we do have here in this country around menopause. And we found in functional medicine that a lot of it is our stress level, and our thyroid and our adrenal glands are so stressed out that how the endocrine system works, and just real quick, and I won't get too sidetracked on this, but
Oh,
the
go for it.
pituitary the pituitary gland in the brain speaks to the thyroid, which speaks to the adrenal glands, which are our adrenaline producers, fight or flight glands, and then they send signals down to the ovaries. So when the ovaries stop working, when they naturally stop working, and when they stop producing the large amount of estrogen, progesterone that they would for childbearing ages, the adrenal glands should, in a perfect working, functioning, properly functioning body, the adrenal glands should kick in after menopause and make a little estrogen, progesterone, testosterone, because we still need them for things like bone growth and muscle tone. And, we need them we need these hormones for things other than making babies. But a lot of Americans, we're just, especially as women in this, age range, 45 to 55, the menopausal age range, our adrenal glands are flatlined. So when we start having these perimenopausal, way before menopause even starts, we start having these symptoms, our adrenal glands and our thyroid are so shot that we can't handle the whole balance of the endocrine system. So we have all these symptoms times 10. So you're right. When they start showing up, that's the time to, we do things herbally or bioidentical hormones. Like, what can we do to get ahead of this and start balancing these so that menopause isn't this like life altering, terrible 5 to 10 years of you don't know who you are because your hormones are so out of balance, and you're crashing and you're angry and all the things that comes along with menopause in this country. So side note, you're absolutely right. When those symptoms start showing up, now's the time to say, okay, and in functional medicine, we look at things that are low normals and high normals. Like, okay, what's out of balance? What can we fix now so that when we get into full-blown menopause, we're not on the floor. So yeah, I had to dive in and kind of say that, because I hear that story a million times. Like, oh yeah, my levels are a little on the low end, but let's just watch it. Even though you could be a little on the low end in the thyroid range or the hormonal range and have all the symptoms. And that's where we have to look at more than just labs. We have to look at the whole person. So yes, we do a lot of work with that also. But I would say the majority of what we see in practice are patients that come in with just a laundry list of symptoms all over the place. And oftentimes, or they come to us knowing they have something like Lyme disease, or we see a lot of mold toxicity. But oftentimes it's people have been to 8 or 10 doctors, they have a stack of blood work like this and a binder, and they still have joint pain, brain fog, chronic fatigue, anxiety, insomnia, GI issues, and we find that it's something else underlying. And oftentimes we do, and that is my history. I think that because I was diagnosed with Lyme disease at 15 years old, and was contracted it in Michigan. I think that because I lived through that, I can look through some of these mystery illness patients and say, okay, this is probably this, or this is parasites. That's another big one we're seeing a lot of patients come up with, which can absolutely affect mood and brain chemistry, because most of our brain chemistry is made in the gut. So we're seeing anxiety and insomnia actually be a parasitic gut infection. And so putting all these pieces together, yeah, we see a lot of medical cases that honestly Western medicine has given up on. Or telling them there's no known cause.
And in some cases, very simple solutions. That is what is mind-blowing to me, is that I had a situation where my allergies, and if you listen to the podcast a lot, I think I've told this story once, but my allergies were going crazy, and I went to the chiropractor because that's what I do. And so did my husband. We were taking like 2 Claritin every single day, year-round now. Well, we would take 1 every year-round, and then during allergy season, we're taking 2. And it's just like, this doesn't seem right. And my chiropractor's like, what are you doing? Why haven't you talked to me? That you've done it for a year. I didn't even tune in that it was like, this is a problem. And so my husband has acupuncture, and he is like a lot better within a few days. And I'm like, I go back to the chiropractor. I'm like, God, give me some. And he goes, well, you may not need it. And I'm like, what do you mean? And he goes, let's test. And so he did, muscle testing to figure out. He goes, you have Candida. And I'm like, blah. Actually, I had heard about Candida. And so he put me on a protocol to solve the Candida. Guess who almost never has to take a Claritin now? Like, love it. One day out of the allergy season, I'll be like, okay, what is happening? And it's like, okay, yeah, the ragweed is crazy and it hasn't rained. And it was totally an issue. Do you tell people what Candida is? Because I do not feel comfortable like explaining what it is.
Yeah, so it was totally a systemic issue that, you take care of one thing and then your body can heal, because we get rid of what we call barriers to healing. So Candida is actually a fungus. It's the same fungus that causes yeast infections, thrush on your mouth, cradle cap, and you can have it overgrown in your gut lining. And again, so much matters in your GI tract and your gut lining. 80% of our immune system's in the gut. So if your GI tract is dealing with this fungus, it's constantly bogged down by the stressor, it can't really handle the allergies. It can't really be that line of defense to really keep you from having a histamine reaction or an overreaction of allergies. We take away this barrier of healing, this fungus, and you're right, it can be so simple. So to handle Candida, It's lowering your sugar intake and taking an antifungal herb, which again is so simple. Oil of oregano, garlic.
Yep.
Those things can kill this fungus. And now we get rid of that stressor. Your body can actually handle the stress of the allergen and it doesn't have to freak out. I look at it as almost like we have this bucket. We have this bucket of stuff we can handle. And when you put in a fungus, you put in a bacteria, you put in airborne allergies, you put in stress, you put in lack of sleep or a cold or COVID, and then your whole system is like, I can't handle it. And then you start having these odd symptoms oftentimes of, constantly itchy eyes or skin rashes. And so we just have to start peeling back the layers and getting rid of the root problems that are keeping your body stressed or inflamed. And Candida comes up often. It is because of the, sad food plan we're on, standard American diet, that we have so much processed sugar that Candida feeds off that. These little bugs just feed and multiply. And yeah, that is not an uncommon culprit that we find to be a slew of symptoms can be from Candida.
I am glad you said what you have to do because I was sitting there going, I remember it was simple. I don't remember. It was so simple. I don't even remember what the air quotes protocol was. But now that you said that, I had to take oil of oregano in a little veggie cap once a day. And then they added a probiotic. I don't even know that. I think I'm already a low sugar diet. So they were like, this is probably left over from the health journey that you've been on. Now that you've kind of cleaned out a bunch of other things, now this is able to kind of bubble to the surface. But yeah, it was super simple. And within 3 weeks, I was like dramatically better. And it was, the oil of oregano bottle was nothing. It was less than the cost of a half of a Claritin bottle, so, and just such simple things that we can do. You also talk about heavy metal and mold.
Yes, we run a lot of environmental toxin tests, which can be urine, can be blood, can be a hair analysis test. I turn to this when a couple things. Patients have a hard time losing weight. Stubborn holding weight. We now know that chemicals, toxins, molds, and I'm talking chemicals like pesticides, things that are in Roundup, heavy metals that can come from fillings or vaccines or in our environment. A lot of these environmental toxins we find are probably in water, food, soil, mold. In the history, if a patient moved into a home or started working in an office and their health just went downhill, we'll test that. But what we know is that the body's brilliant. The body is a self-healing mechanism. It will do whatever it needs to do to keep you upright. And when it's exposed to these toxins, and I'm talking food dyes, parabens that can be in our makeup, heavy metals, it will store them in places. And a place that likes to store them is fat tissue because it's safe. It's getting it out of the bloodstream. It's getting out of, the fluids in the body, the lymph system. So it's hiding them in fat cells, or it'll make tumors or fibroids or cysts. It'll try to encapsulate these toxins. So patients that have stubborn weight loss, they're doing all the right things. I start looking at mold. Is mold sitting in those fat cells? And we can detox these toxins, they can shrink. Also, a lot of these chemicals can cross the blood-brain barrier. So anxiety, not sleeping, systemic inflammation, they feel and look puffy all the time. So that's when we'll run some of the environmental toxin tests, and then detoxing it is one part of the equation. The other is, how are you getting retoxed? How are you getting exposed? And I tell people, we can't completely help you heal in a toxic environment. So sometimes we need to test their house, change their diet, change the beauty products that they're putting on their body. Anything you put on your skin is in your bloodstream in seconds. So we're having to look at, where are you getting exposed? How can we stop the exposure and also detox? And again, detoxing is kind of simple. We have to get the body ready for it. Sometimes we have to do gut healing and building up the body, but it can be as simple as taking things like activated charcoal or bentonite clay. It'll bind to these molds and these toxins and these metals and pull them out of the fat cells and the tissues and out of the organ spaces and dump it into the lymph, and then your body gets rid of it. And again,
wait, you say take charcoal. What? How does it mean? Is this like a supplement? Is a pill or form?
Yep, you can buy it over the counter at Whole Foods right now. I do prefer more pharmaceutical grade typically if I'm really dealing with a major toxicity. But yes, so here's an example. If somebody has alcohol poisoning, they put that NG tube into the hospital. That's charcoal, the black thing they put into they pump their stomach.
That makes sense. Yeah.
But yeah, you can take it in a pill. Okay, here's a life hack.
This is fantastic.
Look, people can't live clean perfectly all the time. I have patients that are like, hey, okay, we've been doing this detox. I'm going on a cruise. I
Yeah.
know I'm going to drink alcohol. I'm going to Mexico. We're going to go to an all-inclusive resort. I'm going to a wedding, like whatever the case may be. But they know that once they've detoxed and they've cleaned up their diet, they know that things like alcohol makes them feel bad now. That's a little trick. I tell them take some activated charcoal before they go to the event, and when they come home right before bed, and the charcoal, expands in the stomach and absorbs the toxins in your stomach, and then gets them out, so it negates hangovers and feeling terrible. So that's a little life hack. That's one way you can
Holy
use it.
crap! That's amazing.
Even if you were out at a wedding and you come home and take 2 capsules before bed, it's super helpful. It can negate a hangover because it will, but it's best to do it about the same time as you're intaking the toxin, which alcohol is a toxin. But so that's one way to use it in everyday life. But yeah, the taking charcoal, I have a powdered form, I have capsules that I recommend, and it expands and it binds to these toxins and pulls them out of your system. And you can absolutely, there's food grade, supplements of this.
So then, if I wanted to do that, is that something you recommend, like, on an ongoing basis? Because, like, to your point, like, we're still eating all this food. Even if I'm trying to eat cleaner, I still, like, there's stuff on the food that even if I'm eating salads and I'm eating the chicken and all there's still all the things. So is it more like I did the Candida, like, okay, let's do a 3-week detox, and then, you're good, and then when you see some symptoms, or do you recommend it, like, on an ongoing basis?
Definitely
Okay.
not all the time. So yeah, a couple thoughts. We have created as humans a toxic soup world that we can barely exist in, right? Like we just have. We've created a toxic world that we can barely survive in, unfortunately. So I do think everybody could stand to go through a detox of some sort with binders, which is what we call the charcoal and the clay and things. However, no, you do not want to stay on them all the time indefinitely,
Okay.
because they will start to bind and strip you of your good minerals.
Okay. Perfect.
So I highly recommend working with somebody in functional medicine, finding what we're detoxing,
Yep.
because different binders work better for different toxins.
Yep.
But if that's not something that you could do, then yeah, 2 to 3 weeks of doing different binders once or twice a year could only help people. There's a couple
Okay.
things that can happen with doing binders. You can definitely get constipated if your GI tract is not strong enough for this detox. So we have to prime the body, build the body up. I've seen loose stools on binders. I've seen the lymph system isn't working to get it out. The lymph system I like to look at is kind of your drainage system. So if you're taking a bath and you're real dirty, but the drain is clogged, right? All of that residue is just going to sit in the bathtub and not drain down when you get out. So we need to make sure the lymph system, the liver, the kidneys, the gut are all, the whole GI tract really needs to be repaired, that we're all in a place to handle the detox. So that's one thought is if somebody just starts taking high dose binders and they get very constipated, well, now we're just stirring up toxins and backwashing it. Down here in Texas, like the Mississippi, right there, the Gulf of Mexico, right? Like we're just backwashing these toxins. I like to speak in analogies and visions a lot, because
I love it.
patients are like, oh yeah, I don't want to do that. I don't want to stir up all that mucky water. No, we want it to flow out into the ocean, right?
Yes.
So we
Yes.
sometimes have to put somebody through it. I actually have a couple DIY programs, and one of them is a drainage lymphatic DIY system where they're taking a different protocol supplements and doing things like dry brushing and coffee enemas to open up their drainage system and their pathways to get them ready to do a detox. So to go in it blindly, I cannot guarantee that the person would do okay.
Don't try this at home.
Yeah.
Be
Or
careful if
do
you try this at home.
Or I tell people, or do and collect the data. Okay,
there
you got
go.
constipated. What does that tell us? That tells us there's something upstream blocking we need to fix. Or,
Okay.
you break, here's another one. If you're doing a detox and the body can't handle flushing the toxins out, the quickest, fastest way for the body to purge toxins is through the skin. Okay, so you erupted some hives or kind of cystic acne or hard pustule. Okay, that tells us the liver is congested. We need to do liver cleanses. So there's a lot of moving parts to it, but I do think pretty much every American right now could handle doing a toxin detox, because we're breathing it, we're drinking it, we're putting it on our skin.
Oh my gosh, this has been fantastic. Dr. Tanisha Wards, I appreciate you.
Yeah.
Because there's just so many things that you're saying that I'm just like, oh, well, duh, I guess I should have thought of that. I'm a big fan of doing cleanse, detox, all the things. I used to have years and years ago, I struggled with hypoglycemia, where if I didn't eat, I could rage. And I did a liver cleanse just I don't
Love
even
it.
remember why I did it. Like I think my chiropractor told me to. Common answer. And so I did that, and I don't have that issue anymore. Like I was
Love it.
shocked. I just thought that was just going to be something I would struggle with my whole life. Was this blood sugar thing where I get really cranky. And so I love that, and I appreciate that you've made it so simple and broke it down for our listeners. Is there if there's one thing, if people are like, okay, this is a lot, where would I get started? Would you recommend starting with like the environmental toxin test, or is there some other things? Is it find a good provider and talk about their symptoms, and that would be the protocol, I
So
guess.
I say this probably 10 times a week to my patients. If you're not pooping and sleeping, your body can't heal. So
Mm.
I would say most of my patients start with gut repair. They come in for hormone issues, gut repair. They come in for fatigue, gut repair. Because so much happens in the gut. Your immune system, most of your brain chemicals are made in the gut. We now know serotonin, dopamine, more of that's made in the gut than the brain, and it goes to the brain. We know so much of your ATP, mitochondrial production, has to do with what you can absorb through the gut. So if you're not going to the bathroom, we know the gut's got a problem. And then sleep. Sleep is when the body heals and regenerates and the cells rebuild. So those two things, if that's not happening, yeah, figure out why. Find somebody and figure out why. But actual action items that someone could take today, and this can be a game changer. I would say most of Americans are dehydrated.
Mm.
Drinking half your body weight in ounces of water. It's that simple. Just drink the dang water. Get rid of, I know, get rid of aspartame. Diet sodas, I think, are the most toxic things. High fructose corn syrup and sodas next. Fruit juice is just full of sugar. Like, get rid of all of it. I have found some hacks for that. There's, again, there's chemicals and I say chemicals, stevia. There's sodas made with stevia that are better replacements, right? Because sometimes going cold turkey is not going to happen for you if you're addicted to Dr. Pepper. Here, again, in the South, that is a thing. But now there's these probiotic sodas, so I've been able to get people off of these. But water and sunlight. And if you are not able
Mm.
to get in the sun 10 to 15 minutes a day, take a vitamin D supplement with K2 in it. The vitamin D has to be delivered in a good quality carrier oil, so olive oil, fish oil. Avoid soy oil or any of the seed oils. It's harder to digest. And I prefer, because vitamin D is fat soluble, so I prefer it in a gel cap versus a powdered form. Vitamin D, or get in the dang sun and drink the water. Like, there's no substitute for drinking the water. You can put fruit in it, but once you add electrolytes or any type of tea or anything, it changes. It's no longer H2O. It has to be water. But you can put fruit in it for flavoring. Some people just hate water. Hydration and sunlight. Those two things alone, I have seen before we even ran labs on patients and changed their supplement protocol or added or took something out of their protocol or changed diet. I send them doing their half their body weight in water and getting in the sun. I see depression lift. I see anxiety lift. I see joint pain go away. They're flushing toxins on their own better. I see brain fog lift just from water and sunlight. And it's so simple. Like, we're not much different than plants. Like, as organisms, just water us and put us in the sun and we're happier.
I love it so much. And even the idea when people say, oh, I just hate water. And I'm like, yes, well, do you love going to the doctor? Do you love not being able to lose weight? Do you love not being able to, have a regular and normal bowel movement? Like, do you hate all of those? Like, let's weigh what we hate. And
Right.
I actually, for Christmas, my family got me a soda stream,
Yeah.
and they didn't get me any flavoring because they're like, she's a weirdo. But a few years ago, when I started my journey to try to cut back on alcohol, I found that carbonated water tricked my brain into thinking I was
Huh.
still having something to drink and something fun
Yes.
to drink. And so in the morning, if I'm feeling just a little dehydrated, I'll just have an extra cup, and it feels like I'm doing something besides just downing water. And I'm telling you, just
Yes.
start to trick your brain. And so if you
I agree.
stop telling yourself you hate water, stop
Yes.
telling yourself that
Water
because
is
it's not
life.
helping. It is life.
Water is
Yeah.
life. And people think water is all about hydration. It's not actually. It's more about flushing. Water
Mm,
flushes, and how water does hydrate is it pushes minerals into the cell. So I have a
hmm.
lot of patients put a little sea salt in their water to help hydrate, but it really is, you're right. When you say I hate water, you are training your brain. Our minds are powerful. So yeah, we need to say this water is healing me. This water is flushing me. This water is
Yep.
helping me live. You're so right. And I love that you said tricking the brain. One thing I'll do at a cocktail party or something, right? I will do kombucha in a little
Mm.
fancy glass and
Yep.
just sip on that. And people just think you're drinking a cocktail. So you're tricking your brain and everybody
Exactly.
else is that we're doing something fun
Exactly.
here.
Yes. Yes. I do
Yep.
some. I'll do a club soda and lime because then I've
Yeah.
even got like the little drink or the fruit just like everybody else does, and it's served. Anyway, so thank you
Exactly.
so much. This has been
You're so welcome.
fantastic. What a great episode. I hope that all of you listening that this inspires you to dare to age well now.